Recording in progress.
Hello all, I am Dr. Bharani, MD Radiologist Resident from Chettinad Hospital and Research Institute, Chennai. So today's topic is study of magnetic spectroscopy in intracranial space augmentations. So introduction is intracranial space augmentation is defined as any neoplasm, either benign or malignant, may be primary or secondary, not excluding any inflammatory or parasitic mass lying within the cranial cavity. Although metastases to brain and vertebra from systemic cancers are far more prevalent than primary tumors. MRI is an excellent modality for obtaining structural and anatomical information of the brain, whereas MRS is a non-invasive technique which provides information about tissue chemistry, biochemical and metabolic information of the region of interest in the brain. MRS also provides information regarding neuron integrity, necrosis, proliferation of cells and their degradation. These are aims and objectives. So to study MRS findings in intracranial space augmentations, objectives to document the results of MRS findings over these lesions. So the materials and methods we use, like patients with signs and symptoms suggestive of intracranial space augmentation who underwent MRI with the duration period were included in the study, like hospital-based descriptive observational study. These patients were subject to MRI study over 1.5 Tesla of GE machine, also T1, T2, flare, DWI, diffusion restriction like ADC, DRE sequences were applied. Post-contrast T1 fat suppression sequence followed by MRS. So distribution was done on the basis of age, gender, diagnosis by MRS, various metabolic peaks and number of metabolic peaks noted within the lesion. So observation results, like 52 patients were included in the study. They are ranging from 0 to 60 years of age, like more than 60 years of age. So this is distribution of patients according to age. So majority of the patients were in the age group of 50 to 60 years and more than 60 years followed by 31 to 40 years of age. So distribution of patients according to gender. So total 27 male were included and 25 female were included. In this study, more than half, 51.9% of the patients were male. Distribution of patients according to the number of metabolic peaks in the lesion. So there were single metabolic peaks for 16 patients and there are multiple metabolic peaks for 36 patients. So more than 2/3 of the patients had multiple metabolic peaks. So list of metabolic peaks noted in the lesions, like most important is choline, then reduced NAA, alanine, lactate, lipid, NAA peak and amino acid. So list of various metabolic peaks noted in the lesions. These are the metabolic peaks among we used. So diagnosis by MRS. So among the 52 patients, 16 were diagnosed with like meningioma, then 8 of them are tuberculoma, 5 with metastasis and glioblastoma, and 3 with abscess, acoustic neuroma and astrocytoma, 2 with low-grade glioma and the others 7. So almost 1/3 of the patients were diagnosed with meningioma, followed by tuberculoma, metastasis, glioblastoma, and this others include NCC, cellular hemangioma, craniopharyngioma, ependymoma, epidermolysis, lymphoma, oligodendroglioma, and medulloblastoma. So this is the diagnostic accuracy of MRS in operated cases. Like test result is like MRS diagnosis, truth gold standard result, that is with goes with the histopathology report. So we'll calculate by sensitivity, accuracy. So specificity could not be evaluated because the number of the true negative cases was 0. Out of 52 cases included in the study, 27 were cases underwent surgery. Post-surgery histopathology reports of 26 cases correspond to the diagnosis made by MRS preoperatively, which yielded a sensitivity and a diagnostic accuracy of 96.9%. So this is the MR spectroscopy image of a patient, showing like solitary well-defined extra-axial intratentorial mass lesion, keeping broad base with the tentorium and homogeneous contrast and enhancement. On the MR spectroscopy, it shows choline peak and reduced NAA. This is highlighted. So this is meningioma. So this is another patient with showing MR spectroscopy, the ill-defined lobulated lesion in the right parieto temporocortical subcortical white matter, which shows a heterogeneous peripheral enhancement on post-contrast. So MR spectroscopy shows choline peak in peripheral and solid component and lipid peak in the central necrosome. So this goes with glioblastoma. So this is multiple ring aneurysm, fairly well-defined, thick and irregular walled lesions of varying sizes involving pons, middle cerebral peduncle and right cerebral hemisphere. So the MR spectroscopy shows like lipid and lactate peak. So this goes with multiple tuberculomas. This is lesion in the right frontal region with significant perilesional edema. So there is a significant peripheral enhancement with central necrosis. The MR spectroscopy shows choline, lipid and lactate peak. This goes with cerebral metastasis. So CT showed that the metastasis like CT showed from left upper lobe masses. This is a lesion with noted in the right frontal lobe with significant perilesional edema and shows complete ring enhancement on post-contrast study. So the MR spectroscopy shows lipid and lactate peak. This goes with cerebral abscess. In this MR spectroscopy image, the choline shows choline peak and relatively higher level of NIA. So this goes with low grade glioma of the pons and brainstem. So this lesion is noted in the left cerebropondyal angle, which shows avid enhancement on post-contrast study. On MR spectroscopy shows choline peak, which goes with vestibular sonoma. So discussion. So magnetic resonance spectroscopy is a non-invasive technique which determines the metabolic changes in the region of interest. It provides an extra edge in the evaluation of brain lesions as it provides information on tissue chemistry, biochemical and metabolic information of the region of interest in the brain. MRS also provides information regarding neuron integrity, necrosis, proliferation of cells and their degradation. It facilitates characterization of the tissues on a biochemical level, which surpasses the function of conventional magnetic resonance imaging, though it is not a replacement of a conventional MRI, but rather it complements the information provided by it. The information given by MRS helps in early diagnosis and treatment plan. In this study, 52 patients were enrolled and the following findings were observed. We observed the majority of the patients were more than 30 years of age, with the maximum number of patients in the age group of 51 and 60 years and more than 60 years of age. Our study revealed with interconnected spatial lesions were commonly males when compared to females. So these are the metabolic peaks like choline peak. Then the NA is a neuronal marker. And in the study, 16 cases were meningioma. We observed choline peak and alanine peak, except of one of these cases reduced NA. So MR spectroscopy diagnosis. Conclusion: based on the results of our study, we conclude the magnetic resonance spectroscopy relatively high sensitive. So differentiate neoplastic and non-neoplastic. And that's MRS is influence clinical to more than research and needs to be done in this modality to define role further in terms of its clinical difference. Thank you.